Right, everyone, just gonna get started here.
Hey,
Hey Pierre.
look at you. What's happening for con?
Not much, not much.
Can you hear me
Just
okay?
yeah, I can. Can you hear me?
Okay. Yep, I can hear you pretty
Cool.
well.
All right.
Excellent. I'm using a new set
Nice.
of, yeah. I have a propensity for washing my Bluetooth earbuds. Actually, all headphones. Aside from like the over ear stuff, I managed to catch those, but somehow the earbuds, while I love them, managed to go into the washing machine. So I I try to get as like cheap as I can, as frugal as I can with them, out of the sheer awareness that they might
Yeah.
be laundered. In any case,
Yeah,
but they sound really great now.
that's
Hopefully, they
good.
won't go through the wash.
Yeah, yeah. I just ate
Just
a
need to check my
protein bar, so
pockets.
it's sorry, it's all stuck in my teeth.
You're
Um,
good.
all right. So
We're talking about therapy.
yes, we are. Yeah, yeah.
Yeah.
Um, so yeah, where do you want to start, Pierre? I mean, it's something you and I pondered about and shared our thoughts. Especially around the importance of therapy and the stigma around it. And I think
Yeah.
we're both doing our part in raising awareness and talking through uh, the value of therapy. But why was this such an important topic for you?
Yeah, well, I think that there's a lot of stigma, and I feel like I've seen it even over the last week in talking to friends who've been reluctant to work with therapists or couples counselors, and I've said uh, sometimes a bit disparaging things about their own experiences, and I think um, that just brought to the fore how much stigma there is, but also how many misconceptions there can be in understanding what therapy is all about. So,
Hmm.
we talked a little bit about potentially going down the path of talking about specific ones. We've even talked about potentially discussing internal family systems or parts work. But I think probably I'm glad that we're doing this because it's more of our own experiences with therapy and what it was all about. But
Hmm.
I guess the start point probably would be a good one. Like, how did you find yourself seeking therapy? And what was your experience even when you began?
Yeah, so I guess what brought me to therapy was I think I was just exhausted of trying to figure things out on my own. And
Yeah.
I think it was also wrapping my head around and changing my mindset. And I've shared this in the past where I used to consider therapy as a way of accepting defeat. So, so the way I viewed it is if I'm going for therapy, I'm basically admitting that, okay, there's something wrong with me. And I carried that for a long time. And I think it also impacted my perspective on it. And finally, I just gave it a shot. And it took me a while to get comfortable with it. And I think one
Hmm.
of the things we're going to talk about is even just opening up about seeking therapy and the fact that I was going. I kept it very quiet and to myself. I didn't really talk about it with people. So yeah, that was kind of it where I realized that okay, whatever I'm doing is not working, and maybe this is something I can try and see how it goes. And then I just found someone that was really close to my uh, office that I could just walk over and see. So it was more of a convenience factor. But then the journey has evolved over time, and that's something I shared with you offline is around my needs changing with time around therapy, and being aware of that, and then seeking out a therapist that can address those needs. And it's very much become a relationship now that I have with my therapist, because even the one I've been seeing consistently for the last 3-4 years, our relationship has evolved in terms of what she can offer me, and the conversations we have.
Yeah. Yeah. I think it's especially when it's a longitudinal kind of a therapeutic relationship where you're going to see different aspects of a person's life, or
Yeah.
you're going to experience different aspects within your own life. It's interesting to think about how it evolves, and I think that's such a natural part of the process. Um, I suppose my story is a bit similar, similar in some ways. I had trouble with the idea at first. So my first experience with receiving psychotherapy and being in therapy was about 20 years ago. And I've worked with several different therapists based on my own geographic location, but also stuff that had been coming up. And at the very beginning for me, that started with being in school. And so I was in medical school when I was first diagnosed with major depression.
Mm-hmm.
And I sought work through the school's counseling service, which allowed for a short, and I think most employers and universities now offer some either employee assistance or student assistance. And that started with just 6 sessions. And that led to an awareness, I think, for me of what was happening in a sort of diagnostic way. And it became clear then that I was pretty open to the idea of using medications. And so, I still have been.
Mm-hmm.
And so I was referred then to a psychiatrist who did both psychotherapy and medication management. And I saw her for the remainder of my time in medical school, but then moved for training, and moved on a number of occasions thereafter. And so there have been occasions on which I've taken up therapy with other physicians, other psychiatrists, and also at later points when I didn't necessarily need any medication adjustments or seek them, I began to work with a psychologist, and I still work with him.
Mm-hmm.
And I've seen him now for going on 9 years, which feels like a long time.
Yeah.
Yeah. And that's evolved. That relationship has evolved as well. I
Mm-hmm.
think much of it has seen different points in my life and career,
Mm-hmm.
and different areas of focus for me personally. So that's been a really great relationship. But mine started really with seeking out services within an institution, which I
Mm-hmm.
think for many people is where counseling service is more short-term, problem-focused work begins before I began to engage in longer-term therapy.
Mm-hmm. Yeah,
Yeah.
absolutely. Yeah. And I think there's really no one right approach. I think you
Mm-hmm.
almost have to figure out what's going to work for you, and what you need in that at that point in your life, or whatever you're dealing with, to figure out what's the right type of service. Yeah. So I guess thanks for sharing that. And
Yeah.
like I mentioned, like for me, it was a bit of a struggle to talk about it initially. Is that
Yeah.
something you experienced?
Yeah,
Did
for
you?
sure.
Okay.
For
And do
sure.
you believe that was because of your own kind of perceptions, or because for me it was my own perceptions, but was it because of your own perceptions, or maybe some cultural implications that factored into your choice of struggling with talking about it?
Yeah, I think a little bit of both. I mean,
Yeah.
growing up, mental health in my family and the sort of the the culture of my family was very taboo. It just wasn't
Mm-hmm.
talked about. And there really wasn't mention of going to see a therapist. And if you see a psychiatrist or or a psychologist or a therapist or a counselor, something is the matter. And often it's like we go down these rabbit holes um, parental, what did I do wrong kind of a thing. And and so I think that followed me. But also, I struggled initially to even recognize that I was experiencing depression and struggled to seek help, which is such a common experience, I think, for men who do experience depression, that there's an almost rigid demand for autonomy.
Mm-hmm.
And for me, there just wasn't a reckoning. It happened so slowly, and I was developing such negative self-critical loops, that cognitive loops, um, that I was blaming myself. And so I thought, if something is the matter, then I'm at fault, and therefore if I seek help, then that just acknowledges my faultiness.
Mm-hmm.
And so I was really reluctant, and it was maybe 18 months or so before I sought any kind of help. And I sort of did that very reluctantly, but it was quite clear that I was struggling.
Mm-hmm.
I, you know, was doing relatively well in school before, and then really had a lot of trouble with concentrating and performing in school, and so it was clear that I needed some help, but I was very reluctant to get it. And I think it
Mm.
was this combo of culture and my own personal perception.
Yeah. 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 I mean, that's fair. And I guess in your case, 20 years ago, you mentioned, right?
Yeah,
Roughly. Yeah. Sorry, I'm not
roughly.
trying to
No, you're cool.
age.
I was 20,
Uh,
22 at the time.
yeah. Yeah. I'm not
Yeah.
trying to put a number there, but I
Yeah,
think
you're
20 years,
okay.
what I'm
Yeah.
trying to get at is 20 years ago, I mean, the stigma was probably a far more worse in that case. Because whereas now you look 20 years later, therapies talk, like we're having this conversation. I don't think
Yeah,
20 years ago there would have been a lot of men talking about this openly,
it's
and
true.
sharing their own struggle with whether it's depression or anxiety. But yeah, I think we've come a long way, but
Yeah,
I just want to acknowledge that, in your case, 20 years ago would have been a lot more difficult too. So,
it was
that's
something.
takes a lot of courage. Um, I
Well,
mean,
I think to your point there, I also wasn't in the field of mental health at the time. Like, I was
mhm,
in very much in medical school, not intending to pursue a career in psychiatry, in part because of stigma. In part, there was
mhm,
this like tremendous stigma around even what it would mean to be a medical student who sought a career within psychiatry. And I think that has changed over the last 20 years, um, but I was late to the game in determining how how influential mental health care would be in my life and how much I
mhm,
wanted to pursue it.
mhm.
And so at the time, there was this extra layer of stigma around um, needing to have it all figured out, but also not knowing that I was going to be pursuing this field and
Right.
committing um, much of my career to it.
Yeah. Yeah.
Yeah,
No, that's and that's kind of a very common theme is often we use that adversity, um, which fuels our kind of passion in terms of wanting to help others in the same realm, and you
yeah.
see that quite a bit. Um, so I guess my next question for you then is, was there ever a time where you were frustrated with the process, and did you ever doubt it? And if so, what was that like? And how were you able to kind of wrap your head around it?
Yeah, yeah. There were a few times. I mean, I think as a mental health professional in later years of receiving therapy, I've been frustrated, quite honestly, by the lack of resources or the sheer need, but difficulty in finding someone who was um, accepting clients. Even now, as I've moved across the country over the last couple of years, I've remained on board with the therapist with whom I've worked for so many years. Um, in part that was just that we have a great therapeutic relationship. I um, enjoy meeting with him and find a lot of value. But also, when I started looking at the options for me, um, I became really aware from my own experience of how challenging it can be to find a therapist, even in bigger, more well-served areas.
Mm-hmm.
And so that for me has been, it's a resolved thing now. I've continued to work with my dude, uh, but it definitely opened my eyes to the experience that I've heard on the other end, which is I can't find anybody. Like
Mm-hmm.
nobody's accepting new clients or new patients. Um, there are long wait lists. No one's accepting my insurance, or I'm having difficulty finding someone who will accept me and my insurance.
Mm-hmm.
And so I'm just aware of that struggle. It's a very real struggle. I think it'd be naive to say that the only struggle is once you get into therapy. In large part, I think the barriers to getting help tend to stop many men from
Mm-hmm.
moving forward.
Yeah. Yeah. And are you hearing that? Because I've heard it too, that, I can't get in or I have to wait a couple of weeks
Yeah,
or whatever. And quite often the issue is pressing, right? Most often people don't proactively book a session
it's
or
true.
proactively book an appointment or whatever. So if the wait is long, then they may go find someone else who may not necessarily meet their needs. So that's a whole slew of issues. But the reason why I'm hearing a lot of people struggling to find a therapist or getting in for a session is also because of the pandemic. We've seen a huge increase in mental health concerns or people just becoming more aware of some of the issues or challenges they may be facing. So I think that's put a lot of the practitioners almost like they're getting a lot of intake, right? So
Yeah, for sure.
so
For sure.
is that contributing to what you're hearing, or this was something you were hearing prior to the pandemic?
This was something that I was hearing so I was very fortunate prior to the pandemic to be living in a city that I was in Pittsburgh at the time and
Mm-hmm.
has um, quite a quite a good mental health network. I think no place is perfect, and certainly there were challenges, um, but for the size of the city and the number of people who wanted and needed help, it was relatively easy to refer um, and to find help.
Mm-hmm.
I think that has changed dramatically since the pandemic. But there is definitely a geographic factor, depending on where you live, what country, what city.
Yeah.
In the U.S., certainly what state. Um, you you find a tremendous amount of discrepancy in the availability of services. But
Yeah.
definitely, the pandemic has made, I think, being on both ends really challenging.
Mm-hmm.
Um, People are finding just a tremendous amount of need and not being able to meet that need single-handedly, and so have had to have longer wait lists, have had to turn people away, which having been there before, is challenging, is kind of
Hmm.
heart-wrenching.
Hmm. Yeah.
Yeah,
Yeah, I
yeah,
think the accessibility in remote locations is definitely an issue for sure. And then the other part is often you find someone that's really far. So are you willing to travel?
yeah,
And I don't know about you. I mean, telehealth is obviously on the rise, but my experience with it's tough, right? I think
hmm,
to do even on the other side as I'm not obviously a therapist yet, but even when I do the
yeah,
practice sessions and stuff, it's tough to be able to demonstrate empathy and compassion over a screen. So I mean, there's definitely challenges with that, even though with Zoom and technology, you're able to uh, reach a lot more people. I think in this field, it's a little bit difficult, especially if someone's really scared or reluctant to seek out therapy to begin with, and they
yeah,
may not, if they don't have a good experience, or they may not feel like they're being heard, it can easily discourage them, and they may just completely walk away from the idea and not follow up.
yeah. I think you're right. I mean, I think people's experiences are really pretty variable with it. In some
Hmm.
ways, the accessibility of telehealth in and during the pandemic has meant that services are more readily available to people.
Hmm. Hmm.
Um, and especially in the States where much of therapy is regionally um, controlled in terms of having access to certain licensed therapists within a state. Um, the states have had to, and the boards of practice have had to make adjustments to make
Hmm.
essentially to make it work. And in
Yeah.
many ways, that's allowed for greater access,
Hmm.
greater accessibility across different geographic locations. But I think to your point too, there are some struggles on both ends. I mean, I do my work now almost totally exclusively um, virtually,
Mm.
and though it's in the realm of coaching, I think that there's the same degree of challenge perhaps. And there are some ways in which it's really been beneficial, and some ways in which I think on both ends it's a little more challenging.
Hmm. Hmm.
It's required, definitely required some adjustment and transition.
Yeah.
Yeah,
Yeah, for sure. Cool.
yeah,
Yeah, no, I think, yeah, so that's obviously several challenges we've talked through, but going back to the I guess the topic here in terms of normalizing therapy,
yeah.
I did have one last question for you on your journey, and that's centered around what are you most grateful for with, obviously with the journey you've been on with therapy and some of the awareness you've been able to gain, but what is the one or maybe more than one thing that you're grateful for?
Yeah. So I now having worked with the same therapist for so many years, I think I forget sometimes um, how his approach tends to speak so well to my own needs personally, and I think part of that is that it was just goodness of fit between us. But I think part of that is also the his own flexibility and his own style. But he practices in he's pretty eclectic, but his main school of therapy is Gestalt therapy, which is very
Yep.
focused on um, naming emotions, appreciating the experience and the sort of experiential element of that emotion. And for me,
Hmm.
as someone who had a lot of trouble with naming my own experiences of emotion, and still kind of like sometimes it's a little bit like pulling teeth, despite a lot of what I do in helping
Yeah.
other men to do the same. Like I'm just aware of my own challenges in doing that. And he's very
Yeah.
good at reeling me in to helping me to reel myself into my own bodily experience. And I
Mm-hmm.
find myself using a lot of those tactics and strategies when I work with men now. And so
Mm-hmm.
I'm really grateful for the capacity to just not necessarily have to come in hot uh, in a session, not necessarily have to know exactly what I'm going to talk about. Because if I don't, then there's an invitation typically to spend a little time checking in to see what's going
Yeah.
on internally.
Mm-hmm.
And I think I need
Yeah.
that. And I realize too at the end of sessions how much more grounded I feel.
Mm-hmm. Mm-hmm.
And
Yeah, I
so,
would just
yeah,
gestalt, what I find it's powerful is you're almost kind of stepping outside of yourself and looking at some of the emotions or things that you may be struggling with from an outside perspective, which
yeah,
is, I think, almost easier. I think as men, we're really good at giving advice, but we struggle with uh,
yeah,
applying that to ourselves. So I think it's powerful in that sense too, and that's been my experience as well.
I
Yeah.
agree. I agree. What are you most grateful for?
Um, I think it's, for me, it's the humility that comes with it. So I've had quite a few experiences over the years where it's humbled me in the sense that not only am I able to have compassion for myself and recognize that this is a healing journey that's probably going to go on for a really long time,
Yeah.
um, especially because we're wired from childhood, right? And for me, the wiring is
Yeah.
really, really strong. So I've had to break a lot of patterns. Um, and then also being able to have that same compassion for other people, recognizing that, my struggle's been so difficult and I've had to put in so much work and gain so much awareness for myself that I'm able to accept that in other people. Now, again, it's hard in the moment. Often, it's easier to get upset with people or yourself, but just having that awareness and reminder almost on a daily basis has been, for me, a great thing that I've had to experience over time.
Yeah, I love that. I love that. I think especially, I'd imagine, and from my own experience too, in learning to be on the other realm, the other side, and working with clients who might face similar experiences. There's something really
Hmm.
truly humbling about and empathy building around being in the same or a similar boat in
Yeah,
terms of experiencing the process of therapy.
yeah, yeah. I
Yeah.
think for me, I also can now appreciate why it is so hard for people to even make change,
Mhm.
and why it's easy to get discouraged, because it takes a lot of effort, and I've had to experience that firsthand. There's been times where I feel like I've healed something or I've dealt with it, and it just keeps coming back up in different forms, and I'm like, geez, like, okay, I thought I dealt with this, right? And for me, I've been able to at least stay consistent with it and really work on it, because I know I've experienced what it feels like to be on the other side when you're healing, and when you start finally seeing things differently, and your circumstances around you change, your whole perspective of the world changes, and how you can invite different situations into your life when you're able to really work hard through those things. So at least for me, that's been what's allowed me to stick with it and motivated me. But I can also see the flip side where it's so difficult, And I can appreciate why it's easier to stay in that. I wouldn't say lack of awareness, but I would say stay in that comfort zone and not really try hard to make a change, because yeah, there's a lot of stuff you uncover, and it is a lot of hard work, and obstacles can obviously discourage us at times.
Yeah. For sure. I think the discouragement sometimes becomes important for the work.
Yeah.
And the discouragement in real time, especially if you're invited to share that experience and what it might be like in the moment. And that gets me to wondering about the in-between work. Like in between sessions, how do you find that you navigate the value, or you carry forward the value of your work within the sessions, or you plan for the next one? How do you use the time in between sessions?
So that also has changed over time and evolved. I think
Yeah.
I've gotten better over time. Initially, there was no, and I've talked about this, so like I can quickly go over how my therapeutic journey has evolved. But when I first started, I just wanted to talk, because there's been years of just things that I had bottled up, right?
Yeah.
So I just needed to let all that out. And that was therapeutic for me, just letting it out. And the therapist I had was just there listening, not offering a whole lot, but just being a sounding board. And then with time, I kind of went through this phase where I needed to heal that stuff from childhood. So then that's when I started seeing my current therapist, and we did EMDR. And for people that don't know what EMDR is, eye movement desensitization reprocessing.
Yeah, that's right.
Yeah, so that allowed me to heal a lot of the childhood stuff. And even then, I wasn't really doing the work in between because it was really heavy in the sessions. So we had a practice where at the end of the session, we would almost put everything in a container and then leave it for the next session. So that at that time I was going a lot more frequently. And then when I was able to work through that, I was also starting to do psychology in school. So my relationship evolved further, where now my therapist knew that I was gaining this knowledge and awareness. So it became more of a conversation that you would have with a peer or a colleague. So now when I go, it's more of a, hey, this is something that's going on. What are your thoughts? And then she'll give me a different perspective. She'll challenge me. She'll give me something to think about. And the in-between work now is really around journaling and identifying the situations that trigger me and doing the work myself, like reflecting, meditating, journaling. And that's kind of where my reel yesterday was trying to demonstrate, is that if I can't deal with it myself, then I know I need to seek her help. And the analogy I've used more recently, it's like, there's certain things you can fix in your car, like at a very basic level, but we all know our level of competence when it comes to our vehicles or whatever. And we know at what point we need to stop, because we know we're going to make it worse. and that's when we call the mechanic and take our car in. So it's the same with the work in between, where I'll do the journaling and I'll do the reflections, but then at one point it's like, okay, I think I need help now. And I've sat on this for a week. I'm not able to make any progress. I'm ruminating. It's starting to impact my sleep, stuff like that. And that's when I seek the help. So that was a very long-winded answer, but
no, that's great. That's great.
Context.
It's super insightful. it's super insightful. I think you, and I like that reel, and I like the sort of the acknowledgement of how much work does go into the in between,
Yeah.
and how
Yeah.
common it is to hit some blocks,
Absolutely.
and
Yeah.
in many cases how wonderful it can be to just reach out and um, get a sounding board, another set of eyes and ears, a different perspective. Yeah,
Yeah. Yeah.
yeah,
And I
that's
mean,
great.
we kind of employ that strategy in various professions, right? Whether
Yeah,
you're a professional athlete, you're a doctor, whatever you may call it yourself, or whatever your profession may be, there's times where you need help from your peers, or people that are subject matter experts, or you need that coaching. And um, and there's no stigma around seeking help in those fields. But for some reason, when it comes to our mental health, there is a bit of a stigma. And I think it's so important to recognize that when we do seek help for our mental health, it impacts everything around us, right? So if we want to be better versions of ourselves, and we've got this thing that's holding us back, by seeking that help, we're not only able to improve our relationships with everyone around us, it improves our productivity, it helps with everything we put our minds to. So I think it's just that would be my message, I guess, if I were to, if someone asked me, well, how can you normalize mental health? It's understanding the impact of not seeking help or therapy, the adverse effects of it.
yeah, yeah, for sure. I think too, this element of um, not losing agency is important. That someone, it's not a matter of you going to someone to be fixed because you're faulty.
Yeah.
And and sometimes
Or,
you were gonna say,
well, I was
or
going to say, yeah, not faulty or broken, right?
yeah, yeah, for sure. And I think part of that is uh, that there's a lot of misconception around the process itself. Um, Perhaps how it's seen in media or how it's been seen in the past, or the people who we know sought treatment in the past, but we don't. And there are many people who probably who certainly have, and not made that known, and so it may feel like the only times to get help are when you feel broken or you feel at a loss. Um, and so the just even talking about the process and what it actually entails feels like it helps to normalize an experience where you're doing the work, you're doing
Mm-hmm.
the real heavy lifting, and you're working with somebody who's able to give you another perspective, perhaps
Yes.
the capacity to put words to the experiences that you're having, particularly if they
Mm-hmm.
are experiences that that have been going on for some time and it's hard to even notice them yourself.
Yeah.
And so it, it's really, in many ways, such a wonderful, empowering experience, and not an experience in which uh, you have to sort of acknowledge a sense of brokenness or faultiness. That's the
Yeah.
really the antithesis of it. In many ways, it's all about building yourself up
Yes.
and working with someone
Yeah.
who's helping you to do that.
Yeah. Yeah. 100%. And I think the biggest thing is it is truly for yourself. So, and I know we talked about earlier that both you and I struggled with sharing with others that we were seeking therapy, and I think it's one of those things that maybe you don't want to share it, and that's fine too. Like,
Yeah,
it's your
totally.
journey. Don't feel like there's an obligation to share and talk about it. I mean, there's nothing wrong with kind of keeping it to yourself. It is very personal. The reason why I feel more inclined to talk about it, because I've been doing it for a while. It's a significant part of my life, but I feel compelled to talk about it because my hope is by talking about it, I can help others normalize it too, and hopefully, you know, they feel encouraged to go seek it out themselves. So that's my hope with it. But I don't think there's any obligation around sharing that part of your journey or your life, and there's nothing wrong if you want to keep it private.
No,
it
not at
is
all.
private for a lot of people. There's years of trauma or abandonment that people need to work through, and that in itself brings a lot of shame. So I think being able to overcome that shame is where you get to the other side. But you know, everyone has their own process and journey with it.
Yeah, agreed. Agreed. And that can change over time. Like
Absolutely.
this is new for me, the capacity to open up around my own experience and to use that in a way as to, I hope, normalize discussion should you
Yeah.
choose to be open about it. But it's your stuff, and so
Hmm.
everyone's experience with that will be highly personal. Nor should there ever be a push to for people to share their own experiences if they're not willing to, or before they feel
Yep.
ready to.
Yeah.
Yeah,
Agreed.
yeah,
Yeah. And
really
the other thing
important.
I did wanted to share was, and I think I've shared it in the past, but I mean, there's many therapists out there, and for you and I who are kind of in the field, we understand that everyone has their own approach. You've kind of shared yours. I haven't really shared mine, but I think the point I want to make here is everyone has a different approach, and sometimes you may find someone whose approach may not align with what you're needing at that point in your life. So don't get discouraged. I would recommend or suggest that if initially you go for therapy and you don't find the right match, don't just assume or get discouraged that this isn't for you. Sometimes you need to seek out more therapists and maybe go see more than one. Um, and then hopefully you can find the right match. But I would be patient with it and seek out more therapists if the first one doesn't line up or the first two don't. Like, it took me a while to land with the one I'm with currently. I think I probably saw 5 or 6 in between.
Yeah, me too.
So yeah, so I would
Yeah,
remind people of that, and something to be mindful of when you are starting this journey, especially early on. It can be obviously overwhelming, but there are times you're not going to find the type of approach you're seeking, and that may require you to keep looking.
yeah, most certainly. And some will take particular approaches that uh, that they will let you know about, especially in the first instance. And so it's helpful to understand and appreciate what those approaches are. But
Hmm.
I just think back to my own experiences with seeing different therapists. One of the psychiatrists with whom I was working for several years took a very um, psychoanalytical approach, which so I was effectively couched for a few years, and it's just not my general style, even as like as a
Yeah.
historically as a provider of psychotherapy, but also it's not the style that I tend to engage with the most. Um, but it was informative in its own right, and sometimes the style doesn't land, and it might feel like you're not necessarily making tremendous progress from the get-go.
Hmm.
And I would say too that that there's a lot of value um, to finding the right fit, but also appreciating just the sheer challenge and the wonderful outcomes that can come about just from being open about your own experiences with someone in a private, confidential way.
Yeah, yeah.
Yeah,
And then Dave, I guess he
yeah,
basically reiterated what we were talking about. And again, you know,
yeah.
being private about it is perfectly fine. I think there's
I
no,
think it's
like you said, yeah,
wholeheartedly.
yeah,
It's important.
yeah. Yeah, and to your point, Pierre, I think for me, and I don't know if a lot of therapists do this, but I would suggest if people are seeking therapy, ask questions early on. But one of the things I like to ask potential clients is, okay, well, what are you seeking help for? Which area do you need help in? And that at least gives you an understanding, and then I'll share my approach. And if there's misalignment, then we know that. And I'll be honest, I'm like, maybe I'm not the best fit for you. I could suggest someone, or maybe go look elsewhere or whatever, right? So I think
Yeah,
having that initial conversation to make sure there's a match or alignment is also helpful. So yeah.
100%. I think that's so important, especially early on, because I think the farther you get, I mean, from my own experience was early on, especially the farther in that I got, the more uncomfortable I felt bringing up parts of the experience that might have felt like it didn't land for me. And I think I
Mm,
saw that a lot in the analysts with whom I worked. Even
yeah.
though the approach that he took was not specifically psychoanalysis, that was his background. And there were times when I wanted just to hear more from him. And it was as simple as asking for it. And I think sometimes we sort of forget that uh, being in the seat of the client, you have a tremendous amount of agency around asking for what it is that you might need. Even if you don't necessarily know what you need exactly, you may be able to just articulate what I'm feeling in the moment, what I wish I could
Hmm.
have more of. And
Hmm.
that's part of the process, I would say. But I love the
Yeah.
idea, especially early on, of setting the framework for revisiting. How is this working? Is this
Yep.
a mutually good fit
Yep.
under the circumstances and based on how I'm processing the situations in my own life and my own inner experiences? Is this style of therapy the best fit?
Hmm.
I would say that uh, there have been times when I felt like personally uncomfortable, like I would let down the therapist with whom I was working if I said, "Well, I think we may be reaching kind of a point of like we're sort of rehashing the same stuff, and can we revisit like either the goals of our work or whether we need to switch gears?" In
Yeah.
many cases, it's a welcome discussion. Um, yeah, and I think there was a
Yes.
question here.
Yeah. So how do you navigate recommending a client to another therapist without possibly making them feel dismissed or unimportant? So yeah, that's a
That's a
very
huge
good
question.
question. I think from an ethical standpoint for a therapist, it's and I don't know if it's the same in the US, but in Canada there's a around level of competency. So there's different ways of going about that, but if you feel like you're not able to help your client or you're not well equipped, it's approaching it in that sense where you're not just recommending them without an explanation, but providing that explanation and saying, hey, you know, my level of duty here is to help you, but if I don't feel like I can, I'm also inclined to find someone or recommend you to someone that can help you. So I would assume in that case the clients received an explanation of why that recommendation is happening, and their well-being is at the forefront. So in that case, the client wouldn't feel dismissed or unimportant because the therapist is doing a pretty good job of explaining why this recommendation may be happening. I don't know if Pierre, you have a different approach, or how would you
Mm,
approach something like that?
yeah, I suppose I'd reiterate or underscore the part about the follow through. An explanation what the reasoning is really important. And also then, is there someone to whom I can refer you, or is there a style of engagement that would
Hmm.
work best for you that maybe I can't provide, or I'm not capable of providing, or I'm not in a position to provide?
Yeah.
Um,
Yeah.
I think for me, it comes up now in the form of men who might reach out uh, for work and would more strongly benefit from psychotherapy than they would from coaching.
Hmm.
And even though my background is within the mental health realm, and at least from an ethical or at least a capacity standpoint, um, I could provide psychotherapy. That's not the realm of work in which I'm engaged at the moment. And so
Hmm.
um, I also recognize too that I have to be true to the boundaries around the way in which I choose to operate and the way in which I choose to work. Because there are times when it feels like I really want to help someone, and I'm licensed in the state. I could, but I'm also um, not equipped from a logistical standpoint and a business standpoint to do so. My work is really predominantly in coaching men in this very future focused way. And if men are coming um, with clear pathology or they need psychotherapy, um, I have to be really honest. And sometimes it feels uncomfortable because I don't
Hmm.
want them to feel like they're dismissed, but I do want them to know that I care, and that I would love to help them as much as I can. And usually that comes in the form of helping to explain what might be really valuable to them, or what I think might be really valuable to them,
Hmm.
and how to go about finding that. Um, if
Yeah.
not directly, then like what do they need to know in order to do that themselves?
Right.
That's a
And
great
the only,
question.
yeah, absolutely. And I
Yeah.
think one of the other things I would stress as a therapist or a coach, while you are helping your client find help, whether it's another therapist or you're recommending them to someone else, be actively involved in that transition piece, because the
Yeah.
last thing you want the client to feel is like, oh, I was like a burden and he's just uh, pawned me off to someone else. But it's like, be actively involved in the transition and ensure that the client feels like maybe this new person is truly helping them, or how do they even feel about the transition, what are some of their concerns about the transition. So make sure the client is still being able to voice that to you as part of that recommendation. So that's another thing I would stress. And one more thing I wanted to mention, Pierre, when you were talking about um, understanding if the client's getting the most out of the relationship, is sometimes therapists will ask for feedback, which is a great opportunity to provide. Sometimes they may not. So, as a client who is seeking help, do not feel afraid to share feedback. If the like you mentioned, you've spoken up saying, "Hey, maybe this is too redundant, or we're kind of repeating the same stuff." Being able to voice that, because at the end of the day, this is your process. So, as a client, be open and share that feedback, because often the therapist may not even know, especially if they're not seeking it out. So yeah, be open about it, and share that feedback. And if it's something that's not landing, then maybe that's your cue to understand that, oh, maybe this might be the end of the road for this relationship. And I've
Yeah.
had to do that. So there's nothing wrong with that. I think, as I mentioned, the in my story is, as things progressed, I felt like my needs also evolved. So there was some times where I had to make tough choices to go seek out help elsewhere.
For sure, for sure. And there's value too in the experience of termination in a way that feels um, respectful and bidirectional, um, and like you're supported. And
Mhm.
so I would say, as uncomfortable as it might feel to be a client asking for something, or either a change of the experience with the therapist or a different therapist, there is some value to helping in that transition period and termination, rather than just sort of stopping without knowing.
Correct.
Yeah.
Yeah. Yeah. Well, Pierre, I was worried about us not being able to fill time, and look at that.
Yeah, man. I think we could
Uh,
keep going here.
yeah, no,
So yeah,
this has been a great conversation, and thank you for suggesting this. I think it's really important that we touched on this before we got into some of the other deeper stuff. But yeah, no, I really enjoyed this. Thank you for sharing your own
likewise.
journey. And I hope people that tuned in or are going to watch this can learn something and hopefully apply it in their own therapeutic journey.
Agreed. Thank you. It's good to see you,
All
Fred.
right. Yeah,
Yeah, man.
likewise.
I'll see
Take
you
care.
in 2 weeks.
Yeah.
Bye.
All right. Take care. Bye.